Now, here is our reporter Laura Windsor with more on obesity.
A growing concern in recent years has been the rise of obesity in children and adolescents. The study of fetal programming research is looking into what influences on the fetus in the womb which could lead to obesity later in life. We spoke with Dr. Mina Desai, a lead researcher who specializes in this study at BioMed, and asked her to explain the obesity research being done.
Currently, 1/3 of US adults are obese. And if you take overweight and obesity together, that's 70%. And more importantly, or of greater concern, is that out of every 3 children, 1 child is obese. Conventionally, obesity has been defined as something that you eat more, take in more calories, and that gets stored as fat. And over time, as you keep eating more, you keep storing more fat and you get obese. But we now know that it's much more complex than just a simplistic equation of taking in food and storing it as fat. And this is the research that has emerged saying that your obesity actually can start as early as in the womb. That's been given a name known as fetal programming. Essentially, it says that during pregnancy, if a mother's nutrition is less or more, it determines how the fetus develops. And that has risks for becoming an obese in later life. And now studies have shown that it's not only during pregnancy, but a woman entering pregnancy who hasn't had optimal nutrition or is not healthy compromises the baby's health as well. It all goes back to how nutrition plays such an important role. The saying has always been there that you are what you eat. But it goes back that you are perhaps what your mother ate or what your grandmother ate as well. The research that we are doing at BioMed becomes critical, and we are pioneers or one of the leaders in understanding that how does the maternal nutrition change so much and affects the baby's or the children's health. We've shown that when you make more fat cells, that your whole system has changed right at birth. And the machinery that makes more fat cells has been hyped up. So you're making more fat cells. And all the machinery that allows you to store more fat is also revved up. So, and the amazing thing is it starts right at what we call as the stem cell, or what comes before the adipose fat cell. So the changes occur right there. So it's like a master cell that has been changed and subsequently affecting all the cells that it produces. Fetal programming, like I said, is all about how environment, maternal nutrition, and recently even environmental exposures like bisphenol, all are related, can cause offspring obesity. I think the whole important message is that how critical nutrition is for women who consider becoming pregnant or are pregnant, and that because it has such grave consequences for not only their children but grandchildren's health and well-being.
So make sure you eat a healthy diet and follow the recommendations from your doctor for a healthy pregnancy so you and your baby won't be at risk for complications. For the American Health Journal, I'm Laura Windsor.